Dennis Anderson. I had both knees, had a partial knee replacement in both my left and my right knee. What I do now is I'm a safety officer on the Trans-Alaska Pipeline. What I did to get my knees to where they were at was I was a carpet installer, floor recovery installer for about 30 years. I also played softball for 25 years, live in Alaska, so hunt, fish, fall off mountains, do the kind of things that hurt your knee. You know, the past 10 years or so, my knees have started to bother me. Good insurance, and that's how I found Dr. Galat down here. Talked to him, did a teleconference, and then went into the office and saw him, and we discussed both full and partial knee replacements. And with the x-rays and CAT scans, I was able to option for partial knee replacement in both knees. Very happy with what I've had done. The recovery was quick. I basically had 3 weeks off to recover from the surgery before I went back to work, and I was able to go back with no problem the first time, and I believe I will this time as well. And overall, I'm 10 days out on having my right knee done. I'm going up and down stairs, pretty much walking without any noticeable limp. So the difference between before and after was I was having difficulty sleeping, pain in my knees, running, walking were, especially running, out of the question. I have almost no pain in the knee that was done 6 months ago, and I'm assuming I'll have the same with the knee I just had done. How I found Dr. Galat was, I had several choices of doctors, and I looked, I had all 5-star reviews on his website, and he got one from me, and he'll get another one from me. And he was just very personable. He was easy to talk to. His staff was so responsive. I call them, email them, they get right back to me. It's been a top-notch experience all the way around. That's what I'm really impressed with. I would send everyone I could his way. The recovery process, they start you off, they set you up on what's called Recovery Coach, and they send you a pre and post-op booklet that you read through, and it prepares you for what you're coming into and what you're gonna have after the surgery. The Recovery Coach thing is an app you download on your phone, and it walks you through the exercises, what you need to be doing, when you need to be doing it. You do pain surveys, but generally they were dead on with what they send you, the paperwork. And I'm 10 days out now, and I'm virtually pain-free and have pretty good mobility already. After the first knee, it was a new experience for me. I was surprised how quickly I initially recovered, and what I had to do probably 2 weeks in was start thinking with my 60-year-old brain instead of my 30-year-old brain, that I wasn't going to be hopping up and running around and playing tennis and doing whatever right off the bat. But within 3 weeks, I was basically pain-free. The only discomfort I have would be trying to sleep. You had to get used to, my knee was still a little bit tender. And then you have to limit your expectations as far as what your age is. The condition you were in beforehand makes a huge difference. If you keep yourself in shape, get yourself in shape, your recovery is going to be quicker and better and less painful. Dr. Galat is an extremely good surgeon, an extremely good man. From my experience with him, he does seem to genuinely care about the work that he does and your outcomes. So I would highly recommend him to anyone.